All right, I think we can go ahead and get started. So I am Maddie Gustafson, and I'm a project coordinator at NEHA. And I'd like to welcome you to the third webinar in the 4-part Data and Environmental Health Best Practices webinar series. Just a few Zoom reminders before we get started. If you have any questions throughout the presentation, please submit them to the question and answer box, and we will get to them at the end of the presentation. Any other inquiries, please send them through the chat feature. So to get started, I would like to introduce Sarah Schott. She will be our moderator for this session, and she will be leading our Q&A after the presentation.
Hi, I'm Sarah Schott. I'm the Open Data Consultant to NEHA. We have been leading you through a series of webinars on open data as a kind of 101 session for the environmental health community and NEHA members. I'm excited today to have with us Sasha Anderson from USAFacts. USAFacts does amazing work on basically making information, factual information that's coming out of governments across the United States way more accessible to citizens and residents, to decision makers and stakeholders. And we've brought USAFacts in because they represent what I would say is kind of a best-in-class example of third-party users of open data. And because in the environmental health field, we don't actually get to meet many folks who do this work of pulling information from environmental health agencies and repurposing it or showing it in new ways to the public, I thought it'd be a great opportunity to bring Sasha in and talk with us today. So thank you all for joining us for this part of our series. And I'm going to turn it over to Sasha to introduce herself and talk more about her work. We'll follow up with a bit of Q&A from myself, and then we will transition to live Q&A with you all, the audience. Thanks.
Thank you so much, Sarah. It's a wonderful introduction, and thanks to all of you listening in to the webinar. I'm really excited to share today about the work that we do at USAFacts. A little bit about me before I'll pull up the slides here, but I'm our partnerships manager at USAFacts, but I've been with the project since the very beginning. Before we launched in 2017, 3 years ago. Prior to that, I was actually working in local government, and I was the person tasked with making our information more publicly available. So I've kind of been on both sides of the fence, know what it is to be working in government and working in data, and then also now working in a nonprofit that is pulling out that data. All right, so USAFacts, what are we? We're a not-for-profit, nonpartisan civic organization, and we exist to collect, clean up, and publish government data. We publish data about government finances as well as data across a variety of topic areas, pretty much anything that you could want information on, from education to public health, criminal justice, we have data on it. So the origin story of USAFacts, we are philanthropically funded. We are a project of Steve Ballmer, the former CEO of Microsoft. And Steve, when he was retiring from Microsoft and transitioning into philanthropy, his philanthropy efforts were focused mostly on economic mobility for kids. And so when you're in that space, you're talking social services, and the government, you know, is the largest provider of a lot of these services. So if you're looking at where philanthropy can plug in, it's helpful to know what activities the government is already doing, where is money being spent, and what are the outcomes for those activities. So famously, he asked our CFO at the time, hey, I'd like some more information on government revenue and spending in this area, you know, something kind of like a 10K for government. Could you get that for me? And the CFO at the time said, yeah, I'm sure I can do that. Give me a couple weeks, I'll pull something together. And now here we are 5 years later, still slowly chipping away at this project to get this kind of information. Because when we dug in to look for the data, what we found is actually that view doesn't exist. If you want an aggregated view of government spending across all levels of government, federal, state, county, city, if all of that financial data, it's not rolled up anywhere. There's no website you can go to and download a file with all of that information. So USAFacts was born to fill that gap, and that's actually what we started with first. I'll touch a bit more on the financial data as an example a bit later on in the presentation, but that's where we started. Some of the challenges we've had in doing this work, when we started, we had an aim of collecting data, across a variety of topics, which meant we were going to agencies and learned in that process how siloed the data is. That something, if you want data on children in foster care, you might go to HHS for one data set, and then you're going to, Medicaid for another data set about CHIP and children's health insurance. You're going to the criminal justice system, you're in DOJ, having to go to different agencies to get an aggregated view of one issue. And also, so that's on one hand, it's pretty disparate. And then on the other hand, you also have a lot of duplication. So an example I love to bring up is we publish a lot of healthcare data, and to get data on Medicare and Medicaid, if you just want to look at how many people are benefiting from these programs, how many people are enrolled on a monthly basis. For Medicare, there were 3 different sources that were all reporting that same measure, and they were actually all reporting different numbers. And then you had 5 different sources for Medicaid. So it's really tough if what is the answer? What is the actual number of people enrolled? And so we will go to each of those data sets, dig in, read the documentation, the methodology of how that number was calculated, and oftentimes speak directly to one of the data analysts on staff to say, what is your recommendation here, and try to suss out what is the best data to publish for our purposes. So that's a little bit about how we went about collecting when we launched, several hundred data sets, and now the data sets we have numbers in the thousands. So some of the lessons that we've learned, and that I like to repeat both from my time with my open data work when I was working in government and now at USAFacts, are one, open data, what you might call open data, is not necessarily accessible. So to give you an example, you might have an agency, actually let's continue to use foster care as an example. So for foster care statistics in the US, those are published every year as a PDF. You'll get a data table in that PDF that will have the last, say, 3 years of data. And if you ask someone, hey, is there open data on a number of kids in the foster care system, they'll say, yes, of course, here are reports. But from our perspective, it's a lot of work if we want to answer the question of how has the number of kids in foster care changed over time, we have to go to each of those PDFs, locate that number, and pull it out, depending on how the file is created. We might be able to do that scraping it, but we also might have to just write it down by hand and go through and open every single year. If we want to look at foster care back, from the 1980s, that's 40 years worth of PDFs that we have to open and pull data out of by hand to be able to answer that question. It takes a lot of time. You might do it if you absolutely had to for your job, but certainly, just a citizen looking for information is not going to do that work. And so for them, there's open data on foster care. It is out there, but for them, it's not accessible. It's not in a format they can use, they can engage with easily. Most people just aren't going to do the work to do that. So open is not accessible. And another motto of mine is available is not necessarily actionable. So just because the data exists doesn't mean that it is either the information that is most needed or in a format that's easy to kind of visually consume and comprehend. So USAFacts, we work to provide what we think of as the most important and relevant government data, but it's not all government data. So we're not at data.gov with a catalog of just any and all information that's out there, we're really trying to think about, if you are a voter, a policymaker, a practitioner, what might you need to make good decisions? And also that helps us, and by us I mean not just like USAFacts, but us as a society, to think about it is not inexpensive to collect and publish data. It's a fairly large undertaking. And so if we have to make choices about what we can publish, let's make sure that we're spending our efforts on what's most important. So that's one piece of it, is what, kind of what is the most important data to be sharing. And then the other piece of it is, how are people consuming that information? So just because, you have it available, for some people, it might be great to have it as, a spreadsheet, and that's a way that they are comfortable consuming data. But for a lot of people, they need it visualized. They need to be able to see that trend line of the number of kids in foster care and see the way it dips down, to be able to catch at a glance, oh, okay, this is the change over time. We have fewer kids in foster care today than we did in 1980. So at USAFacts, we have spent a lot of time investing in our data visualization resources. I'm happy to talk more about what it looks like to access and use USAFacts, but for all of our data, you're able to download it, to get an image of it, to embed it on a website. We've tried to give many ways for people to grab that data and work with it. Other challenges we've encountered. So there are more than 90,000 government entities in the US, and there's not a ton of standardization for how they handle data. Sometimes there is, when it's mandated at the federal level, either that an agency must report something, and that's when we get good data, or they are given funding in exchange for providing data. So that's how we get homelessness data in the US, is that they're called continuum of care communities. And to be a COC, you have to report your data, and in return, you can then be eligible for funds. But for so much of the data that we're going after, it's not standardized in that way. And so there's kind of this just universe of highly valuable information that we're sitting on as a country that we don't get to use in our decision making. So I'll walk us through a couple of examples of where USAFacts has done that work. We can talk more about, what are some other opportunities coming up that we're working on, that others are working on, to go and get highly valuable data. So examples of data for impact. I mentioned that we started with an emphasis on government finances. So I wanted to show that we did that work. We realized that there's not an aggregated view of federal, state, and local revenue and spending. Mostly when we talk about government finances, we're really only talking about the federal government, but actually so much of the money that's collected and spent by governments in the US happens at the state and local level. So we created the first unified view of that. It's still not perfect. We get our state and local data based on a survey that the Census Bureau does. And they are going out and asking these agencies to report information. But we all know that there's a difference between survey data, where you're asking a person and they're kind of making an estimate, versus, like the actual, we may think of as like accounting data of what really happened. So it's not perfect, but it is the best source to do this work outside of going to agency, all 90,000 governments, and pulling their financial reports, which are non-standard. They're not all in the same format. They're not digitized. They're not tagged with, say, this is getting a little wonky, but like XBRL, which is used. So if you're a public company filing with the SEC, you have to tag all of your data and using XBRL. So it's really easy to pull the same field across all companies. So if you wanted to say, like, look at cash on hand for all public companies, you could do that. You could pull that data, and you can't do that for governments. So that's like a long-term view, and there's a lot of great folks doing advocacy work to make it so that something like that would be possible. But this is what we've put together in the meantime. And to talk about how this data is used, we actually work with a couple of senators, Senators Schumer and Romney, are big champions of USAFacts, and we had the opportunity to meet with 14 senators back in DC and walk them through some of this data. Here's an example of one of the visuals that we showed them. And they were able to say to us, like, this is incredible, this is so helpful, and this is not a view of government data that we get very often. And that's true. If you wanted the information that we have, it comes from, so federal financial data is published, well, in a variety of places, but we pull ours from the Office of Management and Budget, their historical tables. You know, it's an Excel spreadsheet, and it's not going to give you the same kind of view as a visual like this. And this tells you, hey, this is where we're spending money, like the broad categories. And if you are a Congress member who is like potentially looking to reduce government spending, let's look at where we really have an opportunity to do that, because oftentimes there's a lot of conversation spent on programs that are not material to the overall budget, that cutting or continuing to fund are really not going to put a dent in the deficit, if that's your goal. So one example of how it's just so important to visualize it in a way that's easy to consume, particularly for folks who are busy, don't have time to dive into a bunch of tables and PDFs. Another example, visualizing the deficit and debt. And this one I really love. I just think it's super interesting because you have two storylines, right? Like both income has fallen in recent years, and also we're doing better than ever. Like you hear those two narratives, and they're both true when you look at the data, as it turns out. And you can see that by separating out market income, so wages and investments, versus income from government support programs. And it's true, income from wages has gone down, but the government has stepped in and supplemented at a higher level, so people's overall take-home kind of pay and support is higher. So my next example is the data that we are publishing on COVID-19. Early in the pandemic, maybe about mid-March, we noticed that information coming out of CDC was just a national view. And we knew that people were going to need to know how the pandemic was affecting their communities so they could make smart, informed decisions. So we were one of the first to start publishing county level data. And how we had to do that is we went to individual state and county public health websites and pulled the data down ourselves. Our whole team spent hours every night doing this. And sometimes it was really laborious. Sometimes data is only published as a map. There's not even like a spreadsheet you can download of the number of cases. It's just a map, and you have to hover your cursor over each county in the map and like write the number down for that day's data. We are doing that all by hand. We now have automated most of it. California, we still do by hand because they just don't report the data in a way that is easy to scrape. And even, the scraping infrastructure is difficult to maintain because it will break. And so then we'll have like that county is down and we have to go and fix it. So we started scraping and publishing this information. And then people started coming to us saying, oh my gosh, like this is so useful. Thank you for doing this. A few examples, we have provided data to Feeding America to help them plan where to allocate food resources throughout the course of the pandemic. We share data with Walmart for them to think about where to locate drive-through testing sites. We've worked with numerous private businesses so they can think about where they might need to close businesses, and also healthcare providers like Kaiser and others for looking at hospital needs and where to send their resources. And then, of course, we actually provide this data to the CDC now. So CDC came to us, they noticed we had the county level data and said like, we're actually, how are you getting this data? And we explained our process. There isn't the infrastructure in place for those public health agencies to be able to report to CDC in this instance. So we actually now are the data providers to CDC. So normally we publish data, government data, but it's a new instance where we've gotten to be the publisher, or the kind of collectors of government data, the source of it. So that's our work on COVID-19. I'm happy to answer more questions about challenges we had to overcome to make this data available. We've also been publishing data on measures to try and track recovery. So we have a hub set up. It has a variety of measures that might help you think about, are we doing better or worse as a country in response to the situation. And most of these measures, where possible, we're publishing at least by state, so that state governments can look and see, like, okay, are the policies that we're implementing, are they working? Are things improving? Or do we need to go back and adjust our policies? And we publish this data, where possible, disaggregated by geography. Because in any issue, not every state or every city is impacted in the same way. And so can we give insight into who is struggling, who's hardest hit? And also we try and publish the data when we can get it by demographics. So what kinds of people are having what kinds of experiences. And then my last example is, I love this one. So we dug into data on fuel efficiency of cars in the US and how that has changed. So we found that, average miles per gallon, it has gone up from about 20 in the 1980s to 26 today. There has been improvement. So you might say, like, great, regulations around increasing fuel efficiency for cars have been effective. But when you dive in, you actually see that pretty much all of the efficiency gains are due to electric vehicles coming onto the market. So if you look in this chart here, this pink line is for regular oil-consuming cars. It's pretty much flat. The fuel efficiency of cars that use gas has not changed. And so that led us to understand that a lot of car manufacturers, there are regulations in place that mandate that they improve fuel efficiency, and if they don't, there are fines for that. And a lot of them are opting to pay the fines rather than invest in R&D, because that's what makes business sense for them. So that can inform your policy response. If increasing fuel efficiency is your goal, then it might, you're either going to want to really focus in on electric vehicles, or you're going to have to change, the size of fines or something about the regulations to make sure that car companies are actually opting to increase fuel efficiency rather than just pay a penalty. That's the end of a few examples of the data in practice and kind of questions we've been able to answer and insights that we can give at USAFacts based on the data we've collected. So now, Sarah, I'll turn it back to you to ask some questions. Let me know if there's anything else you'd like me to speak to, and also really looking forward to answering live questions.
Thank you, Sasha. That was great. I really appreciated all of that insight into the very detailed process that USAFacts takes to be able to make this information available. A couple of questions I had. One, just wanted to define a term that you used a few times.
Sure.
So when we say scraping, how do you define scraping? Because it sounds like because of a lack of data, of open data or machine readable data, you guys have to scrape. And I know what that term means and how I define it, but how do you define it, and why is it kind of a tool that you have to use because better resources aren't available?
Yeah, absolutely. That's a great question. I was thinking about that in the presentation, like, ooh, I should probably go into this. So also just for anyone who is highly technical in the audience, I am not, I'm not a coder, and so please forgive me if I get anything wrong here. But essentially, scraping data is, writing a script, a computer program to go and to identify those numbers that are, say, on a web page and pull it into wherever you want to send that data, but likely to a database that then organizes it so that you can publish it. So that rather than having to look at, if you have a table on a web page and write down every row of data into a spreadsheet, instead the computer can do that for you. So it does speed up the process. It's not perfect. And as I mentioned, it quote unquote breaks a lot, because anytime a government agency chooses to change the format of how they're publishing that data, then usually the scraper will break because it's not seeing the same thing that it was programmed to see. So a great example of this with COVID is that early in the pandemic, a lot of public health agencies, they were publishing the data, say, as a table on their website or a map, and then they went, oh, people really want this data. Let's make it easier for them to consume, which is great. That's like good instincts. And so they will turn to different providers, data visualization software like Tableau or Power BI, and they'll build like a really nice dashboard that has these great visuals and tells more of a story, which is awesome. But now you have all of these data collectors that have built systems to pull the data based on the old format, and we now have to rebuild it for the new one. Where if it was just published either as a file or in an API, we wouldn't have had to kind of reinvent the wheel each time.
Yeah.
And that's like, and that's, I think, speaks to like, it's not an or situation. It's not like, it's an and situation. It's great to publish data in all formats possible. Like make the data available in a machine readable format for the data wonks, for these open data companies, like for the work that we do, and have a really great dashboard that a person who lives in your town can go and look at and glean information from, or can take a screenshot of if they're a journalist and use in their reporting. Like definitely and versus or.
Yeah, I think that's a great point. And I tend to think about scrapers as like a million copy pastes happening. Like little robots just like copy paste off of websites, right? And I've heard from governments like, oh, this actually puts a lot of pressure on our website when folks are coming to copy and paste. So I think it's important for all of us to keep in mind, like if you have your data open and machine readable, in addition to making it easy for the regular human or reporter to come up and like look at your website and see the information on there, that essentially it's less of a burden on your website, the traffic that's coming there. You're not going to have all of these scrapers that are trying to pull information. You're not going to also have the human version of scraping government information, which is public disclosure requests.
Yeah.
And so
yeah, absolutely. I mean, and even just having it up in any format is a step forward, because if you're not publishing it at all, then you're getting people calling you on the hour trying to get it.
Yeah, if a government is just like, gosh, I don't even know where to start with this, but I know I probably should be providing an alternative to public disclosure requests or scraping. What is like the bare minimum thing that they could do with just their existing website that would help groups like USAFacts be able to access their information, one, and two, be able to access their information and use it with more confidence? Because as you mentioned, with scraping or kind of having humans have to like pull these numbers off a website, that can lead to errors, right? And they're not intentional. They're just, that's the process when you're not getting a straight feed of information. So what is like the most basic thing they could do right now that would make their information more accessible?
Oh my gosh, that is such a great question. And also there's so much to unpack there about that. But but I would say there are probably three things I would keep in mind. And this is going to really depend on the resources that that particular agency has. I just want to be mindful that there are a lot of small governments that don't have the luxury of hiring an outside vendor to help them do this work. And so I know there's a lot of people that are really doing the best they can and don't always get the accolades they deserve for the efforts they make to make information available. So that said, I would say and again, it's really, that answer could be the question could be answered in so many different ways depending on who you are. For our purposes, the best thing that you can do is make that data available in a machine readable format, and that's going to vary depending on the size of the data that you're working with. If it's a relatively small data set, you know, an Excel or a CSV file, available for download is awesome, or, you know, zip files if it's larger, or an API if you're passing through a lot of data. And then it also depends on how often the data is updated. If it's every day, then probably something more like an API is helpful when a third-party user is expecting to want to have that day's latest data. So I would say one, it's, you know, that's just sort of like the format, but also to keep in mind as first steps when you're thinking about opening up data are to have conversations with others who are already doing it to make sure that your data matches with theirs. So we have a real challenge in the US with standards for government data. So what kind of information needs to be published along with that data set? In what ways does the data need to be categorized? So a great example is policing like arrest data, right? There are codes for how a certain crime is labeled that then gets rolled up to a larger category. So there's you know, lots of instances that all roll up to like what we would call violent crime. But if they're not all categorized the right way, if you're not treating like the same kind of, I don't know, if one person took a violent action and against another person, like we have to make those, call them kind of the same thing so that it can match up. I feel like I'm being a little vague here. Sarah.
Let me to provide an example. So
yeah.
like we see in environmental health, public health, where essentially inspections are happening for a category of business or facility or construction. And jurisdiction to jurisdiction, we're all doing very similar inspections and recording similar types of information, right? But the kicker is that on those like 90,000 governments that you cited that are across the United States, is that 90,000 of them all chose to name the column headings in their spreadsheet with different terms.
Yeah.
Right? And so if you think about data, it's just like, I'm just looking at an Excel spreadsheet and I've got a lot of rows and a lot of columns. Essentially, the biggest challenge to making use and error-free use of government information in America right now is that essentially we've all individually decided to choose our column headings. And
absolutely.
And it leads to total chaos. We can't compare apples to apples with our neighbors. We can't share information easily with our stakeholders and our federal agency partners. And it makes it really hard, as you've demonstrated, like the scale of work that has had to go on at USAFacts to be able to get that COVID data in as real time as you could get it. That is huge amounts of manpower and frankly, philanthropic dollars that have had to go into that, because essentially we can't agree on column headings. And so, you know, so I think that's the way that I look at it, as like a very plain English way to kind of talk about that challenge that we have to get over. And I think your point of saying, you know, first thing you do is just talk to your neighbors, talk to other jurisdictions, or maybe talk to a state agency that monitors this kind of data and say, what do you guys call this? And there may also be a few data standards that are out there. So there are some resources that well document data standards, and we're certainly doing that. The aquatic facility data standard we're going to be talking about in our next video session. That's going to be with myself and Chris Metcalf. But yeah, that's I really appreciate you sharing that process and how involved it is for you. And then I guess the last question I had for you is there, whoo, that was a B. Is there any health data that USAFacts is currently trying to find more of or trying to use? I know the big focus is on right now, but are there, like, what's your top two on like dream data right now? If you could have it, that you would use it. It could be inspection information, it could be other types of public health or environmental health.
Yeah, that is a great question. My wish list is long, but some of the data sets at the top, I would say, so in health data in general, we'd like to know more about the healthcare exchanges that were set up under ACA. So right now it's just, there's a bucket in the data that's called direct purchase, and they all fall into that. But what do they look like? What are average premiums for them? Who's providing them? What do those plans look like? What kinds of people are signing up for them, to be able to really analyze how has this policy, how effective has it been? How is it working out in practice? So it's definitely one, some more data that could help us speak to ACA. Inspections data, which you mentioned, has always been at the top of our list. We do publish data on, water quality inspections, inspections for nuclear facilities, and there's a couple others that I can't remember off the top of my head. But that inspections data is tough to get right now, and we don't have it disaggregated. We don't have it by state, county, metro. So yeah, if you want to see what testing is like in your area, you can't do that right now. So that would be great. Let's see. I'm trying to think what my third one might be. So this is not data that doesn't exist, but it's just more of a gripe, which is, I just wish it was published quicker, which is CDC data in general, but specifically death and disease data. So right now it's published on a yearly basis rather than a monthly or a weekly basis. They'll do, even the PDFs they publish are also pretty far out of date. So that's really tough. So when we're looking at evaluating COVID right now, we're not able to look at deaths in real time. We have COVID deaths in real time because we've gone and collected that, but we're actually having to compare what's happening right now to just like, oh, well, what happened this time last year, which is a good proxy for how serious this is, but we can't get really interesting insights. Like, there are probably causes of death right now that have gone down because people are quarantined. So we can't track like the drop in transportation deaths from car crashes because people aren't driving. And that would be really neat to see, like, to what extent is our deaths from the pandemic offset by a reduction in deaths in other places, which is, not to say that there's any death is a cause for concern, but that's just really interesting insight that we don't have, and we won't know for a year. We won't be able to tell those stories.
That's fascinating. I think that gap and that kind of insight onto like what we aren't able to track right now is really interesting. I do know in the case of Washington State, about 2 months into the pandemic, they released a report from Washington State Department of Transportation. And they said, basically, they were like, 12 people are alive right now that would have, on average, died in car crashes. And I believe their number of major injuries went from an average of 750-ish. I'm putting like a little asterisk next to what I'm saying because I'm just referencing, but 750 on average for that same time period dropped to 150 because there's so many fewer people on the roads. So that data is really interesting. And I think the Washington State example gives us some insight that the power of this information actually is kind of latent within our local and state governments right now.
So, and that's a really good point, Sarah, is when I'm talking about, data I wish we had, it is oftentimes available by state or local agencies that are publishing. And when I think of, I wish it was available, what I mean is, I wish someone had already done the work to aggregate this all and publish, in for a data set for the whole country, rather than having to go and do that work. Yeah.
That's great. Well, I think that's it from me, and we'll turn it over to our other Q&A from our audience once we join them live. But if you're watching us at home or at the office, and this is kind of the end of the video for you, I just wanted to let you know that this is the third video in our series of 4 on open data and open data standards. Our next video will feature myself and Chris Metcalf, and I'll be presenting the data standard that we have been working on at NEHA on a grant funded by the Center for Disease Control. We're really excited to share it all with you. It's going to be on aquatic facility inspection information. Basically, it's an outline for how to standardize your aquatic facility inspection information without having to change any of your internal processes or any of your inspection processes. So as easy peasy as we can make it for you. And looking forward to that. Thank you all for joining us today. Sasha, thank you as well for that great presentation and conversation. And we'll head on over to Q&A. Thanks.
So we've had a great conversation with Sasha. Want to get into your questions. We have 2 or 3 questions that have been submitted through Q&A and through chat. Certainly, if you've got a question in mind or you'd like some advice from Sasha, please drop it into either the chat or Q&A is fine. And I want to also point out that we've got a poll for all of you. Maddie's going to bring it up on screen here. And that just really helps us in terms of getting feedback from you all as participants and improving webinars in the future in this content. So thank you so much for taking that poll while we're doing our Q&A session. So Sasha, we had a question come in from Daryl Booth. Daryl, thank you for your question. And he asks, could Sasha please comment on the commitment to continuity of a data stream? That is, how does USAFacts weigh the long-term reliability of the source of the data? Examples of concerns might be funding, changing processes, etc. at the source. You have thoughts on that, Sasha?
I have so many thoughts, Sarah. I love this question, and it really speaks to the kind of conversations that we have at USAFacts every single day as we're adding data to our database and trying to make responsible decisions with the data that we choose to add. So from our perspective, we publish everything. We want to make it, if the data set is something that we think that the public would want to know and engage with, then we want to make it available on our platform. There oftentimes is a trade-off you might have several data sets that all speak to the same topic, and you have to make a trade-off between longevity. There might be a data set that's been collected for a very long time, has been well-funded, and you can assume that it will be funded in the future, versus depth. As open data has become something that is more of a focus, and there's more funding to support it. We've seen new surveys come out that then allow us to survey at greater depth, which is wonderful. It allows us to, then be able to break down the data set maybe by, state or local geography or demographics, so you'll have like a data set that might be only a couple years old that has really rich data in it. When we're looking at that, what we do actually is we will so you can certainly have, I think, strong feelings about this practice, but we will often combine data sets. So we want to make everything available. And we source very meticulously to say, hey, our top line number comes from this agency, the breakdowns come from this other agency. So you can track where it all came from, but we'll combine them to make everything possible available. But I would say we're only as good as the agency that we're pulling from. So we are, cannot be subject matter experts in every single data set. We're not the ones that put it together, so we don't have the best insight into it. So we really rely on agencies to provide us the information we need to publish responsibly, to have really meticulous documentation for how the data was collected, so that we can make responsible decisions where you can combine data and where that wouldn't make sense, and then pass on that insight to our users. And I would say, yeah, it is frustrating, that trade-off, where sometimes we get something at a national level, and then you can get that by demographics. But then if you want to look at something by county, you can do that, but then you lose the demographics because it's expensive to run a survey that collects enough data that you have reliable data at a lower geographic level to then dig into also the communities in that area. But yeah, we try to grab everything that we can to the extent that we think it is responsible.
Thanks. We also have a question from Tony, and he asks, do you have any specific data examples for environmental health that have shown anything surprising?
Mm-hmm. So I mentioned earlier I think it was a couple of questions ago, but talking about we do have environmental health data looking at air quality, water quality, inspections data, and I would say that we have that data at a national view, and that is not where it gets interesting. That is really just, you can see whether our system in general of inspections and monitoring as a nation are functioning. If your nuclear reliability inspection rating is like starting to drop, then you're like, okay, that's a big problem. But we generally maintain high rates there. Where it gets interesting is when you look into by city or by county or by specific agency, by water district, public utility districts. That's when you can start to see anomalies, spikes or drops, and that can help you pinpoint where there are problems. And so that's why it's just so important to have both standards that are agreed on within the environmental health community, so everyone is publishing data in the same format, so that data can be connected across agencies and municipalities to be able to do that analysis at scale. Rather than, like a local reporter going, and always checking the website, and one day they might notice the change in the data, but for someone, who is not keeping an eye on it every day, it is hard for us to pull out those insights without the standardization and the ability to collect and aggregate.
Yeah. So what I'm hearing from you, the lack of standardization, the lack of being able to aggregate are these major challenges to being able to notice trends on the local level or the state level.
Mm-hmm.
Yeah. Are there types of data that, maybe I've asked this a little bit prior, but are there, priorities that USAFacts has right now in terms of data that it's seeking out, or if folks are on our attendees here, that they should reach out and tell you that they have it? If they do, are there a few types of data that you're looking for right now to try to be able to aggregate?
Yes, so we have, a long-term data roadmap, and we're looking at data, we're trying to cover a wide range of topics to give not just depth, but also breadth to our site for users for what they're looking for. So that's kind of work that's ongoing, and, it's an unsatisfying answer. We're looking for everything. But I would say that in 2021, we also try and prioritize data collection for what is in the news. What are people talking about? What are they looking for information on right now? So policing data is top of mind for us. Continuing to track COVID-19, being able to get more data that helps us measure the impact of it and the recovery, and how recovery efforts are faring. Are the policies and programs that local governments are passing, are those effective? Are the kind of stay-at-home orders and social mandates, how are those performing? So we're looking at data there. There's a really interesting, I was reading an article the other day that was talking about being able to do wastewater testing to track outbreaks, particularly, on say like college campuses. I think there was a college that did that with pretty good success. And so being able to have access to data like that would be incredible. But generally more COVID-19 data. And then, policing, COVID. I would say those are the top two. And then we're always, trying to look for data to help track the economy, particularly during this time.
Interesting. I could see how even restaurant inspection information might be a economic indicator right now. You could see if certain restaurants are closed or no longer permitted because they've closed, and that could show a change over time, perhaps in at least one sector of the local economy.
Absolutely. And, that's a great point, because, one of the things that we really struggle with is like quote unquote small business data. I mean, the definition for what is a small business is pretty fuzzy. And then it's difficult to get, from each state, you know, business registrations, and then enough information about that business to be able to answer the question of how are small businesses faring. And on a, you know, timely enough that it's not, you know, a year or 3 years out of date. Yes.
That's definitely an issue that we've seen too. So we've got a few minutes left, and you know, don't be shy, folks. Any question is really welcome here. If you'd like some advice for your jurisdiction on how to engage third-party users of data, we'd be happy to dive into that too. I would just pause for a moment here and say that I'm going to drop a link into the chat as an additional resource on third-party users of open data. Oftentimes they're quite hungry for environmental health data, particularly around inspections. One of the other really prominent users of open data in the United States, at least, are the Code for America brigades. And these are local volunteers, usually in your own community, your own cities, your own counties, who are technologists or people who are just, you know, like civic volunteers looking to build apps, websites, resources for your local community based on your data. And there's been so many successful, impactful projects that have come out of the brigades from Code for America, and these are just volunteer organizations. So I encourage you to take a look at the CFA brigades and see if there's one in your area. If you are interested in engaging directly with some third-party users in very low stakes, friendly conversations, they are a great place to start and to get great feedback or even test your early open data projects with. So I highly encourage you to take a look at them. And then I will, let's see if we have any other questions from folks. Thank you, Sasha, for putting your email address in the chat here. I appreciate that, so folks can follow up with you. And then I want to remind everyone that we have we'll be presenting the SAFE data standard for aquatic facility inspections, a project that was funded by the Center for Disease Control, and we're really excited to share with you. So please join us for that, same time, same place. And yeah, I think I'll wrap it up unless we have any more questions come through from folks. So that is it. Well, thank you so much for joining us, and I look forward to talking with you next week with Chris Metcalf on the call. Thanks.